Good morning. For the record, my name is John Fitzgerald, District 3 City Councilor. I'm the chair of the Boston City Council Committee on Public Health, Homelessness, and Recovery. Today is May 10th, 2024. This hearing is being recorded. It is also being live streamed at boston.gov/city-council-TV and broadcast on Xfinity Channel 8, RCN Channel 82, FiOS Channel 964. Written comments may be sent to the committee email at ccc.health@boston.gov and will be made part of the record and available to all councilors. Public testimony will be taken at the end of this hearing. Individuals will be called on in the order in which they signed up and will have 2 minutes to testify. If you're interested in testifying in person, please add your name to the sign-up sheet near the entrance of the chamber. If you're looking to testify virtually, please email our central staff liaison, Megan Kavanaugh, at Megan, MEGHAN, Kavanaugh, KAVANAGH, @boston.gov for the link, and your name will be added to the list. Today's hearing order is on docket number 0415, order for a hearing to discuss the current trauma response resources in the city of Boston and the potential for expansion. This matter was sponsored by myself and was referred to the committee on February 28th, 2024. Today I'm joined by my colleagues in order of arrival, Councilor Ed Flynn and Councilor Aaron Murphy. I think, did anyone have opening remarks? Should we go right to the presentation? Up to you guys. Yeah. I'll start with opening remarks from my councilors. You good? All right, we're good to move? Yeah, we'll get right into it. I'd like to introduce the first panel. Panel, if you please just introduce yourself each, and then we can see the presentation. Thank you very much for coming.
Okay. Great. Good morning, Councilor Fitzgerald, Councilor Flynn, and Councilor Murphy. My name is Dr. Basolo Jakutu, and I'm the Commissioner of Public Health for the City of Boston and the Executive Director of the Boston Public Health Commission. Should I jump right into my testimony, or should I just allow my colleagues to introduce themselves too?
Whatever you guys want. Yeah, why don't you all introduce yourself at first, and then we can go back.
Yeah.
Yep.
Yes, thank you. I'm Reverend Mark Scott. I am the Director of the Division of Violence Prevention at the Boston Public Health Commission.
Good morning, everyone. My name is Isaac Yablo. I am the Mayor's Senior Advisor for Community Safety.
Great, thank you. And thank you, Chairman Fitzgerald, for having us here today and for elevating this really important issue. We believe that community violence and community violence prevention is vital for the health of residents and in Boston. And as you know, the Boston Public Health Commission places violence prevention as a priority, and we're committed to utilizing a public health approach to address this issue throughout our city. First, I'm pleased to announce that what was formerly the Neighborhood Trauma Teams Network has recently been renamed to the Community Healing Response Network. Changing the name of the program is part of refocusing our efforts on healing, resiliency, and the positive assets of residents and communities. While the way we talk about this program is changing, the principles behind the network remain the same. So I'd like to give you a little bit of history. The network was first launched in January 2017 to address violence as a critical public health issue. This was a shift. Violence as a public health issue is really important to acknowledge because violence itself not only tragically causes physical injury or death to the victim, but exposure also impacts entire communities, causing emotional and psychological trauma. There's a large body of research that indicates when communities experience violence, residents feel unsafe, they feel stressed, anxious, and depressed. Chronic exposure to violence can also lead to an increase in aggression and violent behaviors amongst those who have been exposed. So it ends up being a vicious cycle, one that needs to be broken. Unfortunately, residents in concentrated geographic areas in Boston experience relatively high levels of community violence. In addition, residents in these areas may also mistrust services that are offered, particularly behavioral health services, which could help mitigate the impact of exposure to community violence. The network is designed to provide trusted services to community members who are exposed to community violence. Key to this model is the idea of embedding neighborhood-specific teams comprised of community members within their own communities. These teams pair with community health centers, with community-based organizations, and with others in order to provide comprehensive trauma support to residents. The organizations that make up these teams are trusted anchors within their communities and have credibility and cultural and linguistic appropriateness to the communities where they work. This can help overcome resident mistrust and stigma around seeking services. The network's clients include family and friends of those in violent incidents, witnesses and bystanders of violent incidents, and also the wider community. The goals of the program remain the same as they were at the program's origin in 2017. We are dedicated to reestablishing a sense of safety for impacted individuals, supporting healing, and reducing the impact of violence on our communities. Today, the Boston Public Health Commission supports a network that includes 9 neighborhood teams: the Lewis D. Brown Peace Institute, Boston Medical Center, Brigham and Women's Hospital, and Children's Hospital. In a few minutes, I'm going to turn it over to my colleague, Reverend Mark Scott, who will talk in more detail about the roles that these organizations play and how a resident impacted by community violence might experience their healing journey. But before I close, I do want to highlight our role as the Boston Public Health Commission. First, we fund the network through our city appropriation and through grant funding. We currently have 5 FTEs who support the training, policy, administration, data, and evaluation management of the entire network. Under the leadership of Program Director Donald Osgood, BPHC staff send incident notifications, manage incidents, provide training and technical assistance, convene network meetings, and overall ensure the fidelity of the network model across all participating organizations. Additionally, I'm really excited to share that we're working to bring some additional functions previously performed by a vendor in-house. Previously, we engaged JRI, or the Justice Resource Institute, Boston Trauma Response Team, to act as a mobile team that could respond across neighborhoods for early intervention at the scene of an incident soon after it occurred. They also staff the 24/7 support line. We are moving towards having BPHC employees perform these functions, and we think that this change will provide greater accountability, build our internal capacity, and also provide more flexibility in how we respond to incidents. Thank you for listening. I'm happy to take questions, but now I'll turn it to Reverend Mark Scott, who will talk more about the details of the network.
Thank you, and good morning. Again, my name is Reverend Mark Scott. I am the Director of the Division of Violence Prevention at the Boston Public Health Commission, where I oversee programs aimed at violence prevention, intervention, and response. Previously, I was the Program Director of what was then called the Neighborhood Trauma Team Network. I can make that work. Great. As Dr. Ojikutu mentioned, 9 neighborhood teams operate currently. These teams are responsible for outreach and engagement after an incident, for providing short-term care, like outreach and crisis intervention, and for long-term care, such as ongoing behavioral health services. So those neighborhood teams are on the screen now. They include, for the Bolton Geneva neighborhood, the Bolton Street Health Center, as well as the Greater Four Corners Action Coalition. We tend to think of that as a dyad, 2 partners working together. In the health center, it's addressing health and social needs. In the community-based partner, it's doing the outreach, the relationships, the knowledge of the neighborhood. If you dig deeper into the health center, you'll find 2 people working together, one a clinician and the other a family partner who is supporting the efforts of that clinician around the concrete services, the social needs of the people they're serving. Over in Codman Square, it's the Family Nurturing Center, which has put together a team inclusive of one of the churches in the neighborhood, as well as other organizations that are there. Really, that focus largely on the outreach and the aftermath of violence. In East Boston, it's the East Boston, or the Neighborhood Health Center, and North Suffolk Mental Health. For the Greater Nubian Square, Whittier Street Health Center partnered with Madison Park Development Corporation. Over in Grove Hall, the Harvard Street Neighborhood Health Center around Project Right, and Jamaica Plain, Brookside, Southern Jamaica Plain, Tree of Life. Both Brookside and Southern Jamaica Plain are part of Brigham and Women's Hospital, Mass General Brigham, and so that brings into partnership with the hospital. For Humboldt and Community Academy Homes, we are better together. Over in Mattapan, the Mattapan Health Center, of course, as well as Mothers for Justice and Equality, who are joining us here today at Upham's Corner, the Upham's Corner Health Center. In addition to the neighborhood teams, which are embedded in their various communities, we have the hospital partners who provide direct services to impacted individuals, and families, very much formerly Boston Medical Center, which is a contracted partner, longstanding partner of the Health Commission, but as well Brigham and Women's Hospitals, and then the other hospitals as well, although it's more informal for Beth Israel, Mass General Hospital. And then, of course, the Peace Institute, which is a pillar in the effort. And so in the case of a homicide, very clearly, but also generally as a partner in the community around really transforming how we think about these issues and how we work towards preventing homicides and healing in the aftermath of it. I say all of that to also say Happy Mother's Day to any of the mothers, all of us really in the room. So in terms of what they all do, this is more of a slide that tries to get at the services. So the network, taking in its entirety, provides a continuum of services to individuals, then families, close friends, and communities impacted by community violence. So the big elements in that continuum start with individualized services to immediate family and friends of impacted individuals, and then outreach, community support, and education as needed, as requested, referral services to the broader community as a whole, and then finally behavioral health and related support services for community members of all ages who are vulnerable to the lasting impacts of exposure to violence. So these services across that continuum would include access to a trauma line for free, confidential services, a way to connect to all of this, immediate crisis response in the case of a homicide, referral to ongoing behavioral health services for individuals and families in need of ongoing and long-term support for trauma recovery, trauma support during vigils, memorials, and funeral services as a family would request it, support for neighborhood outreach and education, and trauma education and supported community meetings, and then community coping groups, healing groups. That's kind of all from a perspective of what we're doing. We want to try to depict what happens in this next slide if you're a resident in the community. So in day one, day two, particularly, and we're thinking here largely in the case of a homicide, you would expect to see a trauma response team in the neighborhood really close to the aftermath of the incident. And then as we go, and then of course, EMS, which is part of the Health Commission, a partner, would transport the individual to the hospital. Oftentimes family members, they're not at the scene, they're at the hospital. And so the hospital partners are meeting families in the hospital. We tend to use the term, the hospital in real time, while the surgeons are addressing the physical needs of the patient. The team at the hospital is addressing the social needs. The tool that we're using in those moments is psychological first aid, PFA, you'll often hear us say, which allows us to make contact with the person to then begin to walk them through the 8 steps of PFA so that they're then connected into ongoing long-term healing services. But in that moment, on day one, the hours afterwards, that's what's happening in the hospital, and what the response team is doing in the neighborhood is also PFA to whatever residents that they're in contact with. In the following days, say 3 to 10, that team, all those teams that I mentioned, depending of course on what neighborhood it's in, will determine which team is doing the work. But they're meeting themselves to figure out what is the response plan, and then they're going out, they're canvassing in the neighborhood. They may be receiving calls for people who need support. I think this is an area where our partnership with city councilors, other elected leaders and leaders in the community is helpful, because we don't always know. we don't always know who we need to be connecting to and reaching out to. So in those days, and even beyond in the months going ahead, that's where it's very helpful. In the case of a homicide, and I want to say we're probably at 100% on this, the hospital will ask the family, we do have partners who can support you. Are you interested in the support? Most families, not necessarily all, most families say yes, and then there is a private connection made with the Peace Institute. The family ends up being supported by the Peace Institute. Our rule of thumb then, in those days, 3, 4, 5, 6, 7, is we help the Peace Institute help the family. And part of what we're trying to address here is that in the past, what would happen is some families, not all, some families would get multiple offers of help, which only creates more confusion and difficulty for the family. We're trying to keep that private and quiet and focused. And that's what the Peace Institute is able to provide. And then we're helping them support the families through that. And then we're designed so that as you come through the funeral, as you're beginning to try to figure out what life will be like in the aftermath of this loss, that the network in its entirety, including other survivor-led created organizations like Mothers for Justice and Equality, like your local community health center, like the community-based organizations in your neighborhood, are there for the rest of, as long as you need them. And so the funding we're giving that goes to those therapeutic services in the health centers are so that the health centers are able to provide that service in addition to what they're able to provide as they bill for services. So we're trying to purchase more mental health services for them going forward. So that's what a family member, friends of the family would experience when working with us. In the community, so on the community side, as I said earlier, the response team is in the neighborhood, and then that neighborhood team is there. So response team on the day, the hours afterwards, the neighborhood team in the days afterwards, and then ongoing, as we're talking now months and then going in a year, that continual presence, continuing to build relationships with the residents that are in the neighborhood. So that's the experience of both the family and the residents. That's a lot of words. I think so one of the things is the reason why we have the support line 617-431-0125 is don't have to know all that. Just call, right? And if you don't remember that number, Donald Osgood is the leader of the team. Call him, call me, call Isaac. Then we're working to get support needed related to this incident of community gun violence. And that's the experience that a constituent or resident would experience. So one thing I want to say as I wrap up and close is none of this happens without the partner organizations, without all that long list of organizations. That none of it happens. We didn't create any of them. They were existed within the community. They will continue to exist within the community. I think what we're contributing, as Dr. Ojikutu said, is some funding to support their work, and then all of that coordination and networking that happens to try to pull us all together. So a huge appreciation and thanks to all of the organizations that are in the network. And with that, really thank you very much for this opportunity. Turn to my colleague from the mayor's office, Isaac Yablo.
Thank you, Reverend Scott. So again, Isaac Yablo, Senior Advisor for Community Safety to Mayor Wu. My central role and kind of relationship with the network, the mayor needs to be in the know when incidents of community violence occur. And so I am oftentimes, when there is a full notes call out, where there is penetrating trauma above the waist, I am on scene with members of the Community Healing and Response Network, My role is slightly different. I am not trained in PFA, and I'm not there to provide PFA. I'm obviously there to support any constituent that's in need of support. But my central role is to facilitate the information from the providers to the mayor's office, and then facilitate what we can do as a city back to the providers. I think we have the Peace Institute here, Mothers for Justice and Equality here. The work, and I stress what Reverend Scott said, the work that the providers do external to the city are integral. Real-time information would not be possible to be shared without the providers that are external to the city. And so in addition to the work that we're doing across the 9 network teams, the other external providers are more than integral. So I'd be glad to answer any questions that folks may have about my role as well.
Thank you. Thank you, Isaac. Appreciate it. I'd also just like to note that we've been joined by Councilor Coletta here as well today. And thank you to all of our panelists. I'll first acknowledge the sponsor, which is myself, to begin with the first round of questions, and then I'll turn over the floor to my colleagues. So very quickly, thank you for the presentation and thank you for being here. The Community Healing Response Network, this new name, is that the new name for the entire network or just for the trauma response team within that network?
So it is the new name for the Neighborhood Trauma Teams Network. That is how we are defining it. And I think it's an important change, as I mentioned, because it really is talking about assets as opposed to, deficits. So that's where the direction that we want to go into in terms of healing the community when an event occurs.
Okay, thank you. And then the fundamental changes, because I know you talked about more neighborhood-specific teams going out there. So can you just, again, briefly describe just a couple of bullet points, what the fundamental changes of how it was to what it is now? It went from citywide service to a neighborhood team focused. That's the crux of the fundamental change?
So I'll let Reverend Scott speak a little bit to that, but I would say that it really is just about philosophical change and how we're looking at healing and resilience and assets as opposed to looking at deficits and the criminal aspects of what's happening here. So I think that's the fundamental change. In terms of how it's structured, that's not changed. It's still very neighborhood focused, very community oriented, and as Reverend Scott spoke to, really is about partnerships and people with lived experience, community members actually helping to solve problems. Mark?
Yes. Basically, that captures it well. I mean, the structure does not change with that name change.
Okay.
So from the very beginning, this idea that you have to be embedded in the neighborhood, you're not swooping in to save. The neighborhood has resources that are right there, that are embedded, that were already there, that need support, need networking, need coordination, but they're there, and they've been there. And that's where the healing will come. And so that structure is changing. And one of the things I think that prompted the change is hearing from those neighborhood organizations, those neighborhood partners. We really don't want to lead with the word trauma, because you're speaking right into the wound. You're touching right. We want to lead with the word healing. We're healthcare.
Yep.
So it's a name change that more captures our philosophy in the first place. So we're trying to align more with the philosophy we already had, the principles we already had, to make it stronger. And that name, Community Healing Response Network or Neighborhood Trauma Team Network, is the whole thing.
Yep.
And each of those parts, you can think of them as pillars that hold up the whole thing.
Thank you. How do we decide what to show up at? I know, Isaac, I heard you just say any penetration from the waist up is sort of where you're unseen. Is that the same? Because trauma comes in many different forms, and so what are we responding to in these neighborhood, specific, ingrained in the community teams that are out there?
For this network, for this team,
Yep.
We're responding to community gun violence. If it is a homicide, or we're concerned that it's a homicide, and that's determined, we get the notification. We know because the BPD has told us. So,
Yeah, take me through that too. Just the step by step, how you're notified and what happens in the immediate.
So the BPD is a key partner in this, and this may sound minor, but it's actually one of the huge improvements in how we do this for the city. Because it's the BPD, and they send us physically, it's an email,
Yep.
right? So they send the notification. We get it directly. Our responders get it directly. Of course, Dr. Diablo is getting it. It may be a little bit faster than we get it, only because getting closer. Only thing faster really is walkie-talkies. What's important about that is it's all. We know about all of the gun violence, not just what we overhear, not just what makes the news, but all of it. And so then we have a set of criteria that say what we begin to do. So if it is a homicide or a possible homicide, full notes is kind of the word you'll hear us say. But the police are concerned this person's injuries may be significant enough that they might die.
Yep.
And so when it's that means we want to send that response team to the neighborhood. But that's saying to our partners in the hospital, of course, they're knowing about this as fast as EMS is moving, right? We want to have our response team at the hospital, right? So
that's where you wouldn't go to the scene of the crime, you would go to the hospital.
The hospital team goes to the hospital, we go to the scene.
Gotcha, thank you.
Right. And then at the same time, while this is happening, it almost doesn't matter. It could be 9 o'clock at night, it could be 1 o'clock in the day. 5 o'clock in the morning, we'll probably pick it up 8, 9 o'clock in the morning sometimes. But at any rate, we're sending an email to the appropriate partner. So an email doesn't sound like a big deal, but what that email is doing, I like to think, is it's creating a container for that incident with the right partners in it. And then they're beginning to say, okay, what do we need to be moving into place to support this incident, this family? And if, for example, we see it's a juvenile, there's a possibility that they're a Boston Public School student. So now we need to reach out to BPS. We have partners. They're not formally part of the network, but they're close partners. We got to reach out to BPS, and then they will be able to say, okay, this is what we need to do for this school. Again, protecting the privacy of the individual, of the school, and doing it in a careful, and BPS knows their schools, so they know their students. So we're working in partnership with them on that kind of initiative.
Thank you. Final question before we pass on. My first budget, so I haven't got to read through everything yet. How much are we funding the third-party providers or support systems that we use? Do we know?
So I have the total. It's $2.65 million from our city appropriation, and then we have grant funding from Children's Hospital, $484,000. And we'll certainly be talking about that more in our budget hearing too.
Great. Thank you very much. Councilor Flynn?
Thank you, Mr. Chair, and thank you to Isaac and to Dr. Ojakutu and Reverend Scott for being here, but more importantly for your leadership as well on this issue. Listen closely to all three of the panelists, and Reverend Scott, can you go over what the steps to be taken maybe for a district councilor if there's gun violence in her or his particular district? Can you give us any recommendations on what the responsibilities are for a district councilor when there is gun violence in that district, and what role should they be taking? They want to be as helpful as they can, I think, but they don't want to do something that adds confusion or adds uncertainty or a mixed message either, because I know we did speak about mixed messages. So what are your thoughts on that, Reverend Scott?
Yes. So one, I think there is great, rich opportunity for, we've already seen partnership with city councilors, right? That's already happening. And it's a great opportunity. The way I would come to it is, you know your district. You know your constituents. Your constituents are calling you. This hurt us. We're concerned. We're frightened. They may say, what's the city doing? I described all of that, but we're not necessarily walking around with posters that say we're from the city, right? Our partners, they're funded by us, but they're not from the city. They're our partners. So they might say, oh yeah, Isaac, he was great, right? But he works for the mayor. they're not necessarily making that connection. And so you may hear it. It may come across as a negative complaint, but what it really is we have a need. We're looking for support. We're looking for help. You know the neighborhood associations. You know when the neighborhood associations are meeting. And so I think us being in those meetings, us responding to those individual constituents is really at the core of what it is we want to do to meet the needs of those residents. This is also an exposure to trauma for you as well as for your staff. And so I know recently one of the programs in the division is the Capacity Building and Training Initiative. And they do trauma-informed training around various subject matters. And so they were here doing a training for staff around how do you respond to those calls from constituents in a trauma-informed manner for the constituent and for yourself. And so that was the first time anything like that happened, but it's something that I hope we can continue to do, because I think it gets at your question, Councilor. What's our role? What's our responsibility? And our staff, and how do we do it in a way that's helpful, not a mixed message, and also not harmful to us as we're doing it. So I hope that.
It was helpful. Thank you, Reverend Scott, and thank you for what you're doing. I've had an opportunity also to work with Isaac for many years. Isaac, one couple conversations I just wanted to let the public know about is you looked at the crime stats over the period of time, and you obviously noticed, like I noticed, the crime stats, especially in the summertime, and where services are needed, and you determined that services would be needed in the Mary Ellen McCormick in South Washington Public Housing Development. So I want to say thank you for being proactive, and before the summer, in trying to identify how we can work with neighborhood organizations, young people, residents of the public housing development, to engage them on positive services, positive programs. So just want to acknowledge you taking the initiative and listening to residents, listening to young people in a positive manner. So thank you for doing that.
Thank you.
And finally, I just want to ask Dr. Ojakuchu, who I've also worked with for many years, and thank you, Doctor, for the work you're doing on public health and violence prevention. I know this issue well, but almost from a different perspective too. I know the trauma military families go through and veterans go through, being exposed to violence in certain settings, especially overseas in a war. But how important is it, Doctor, for families of victims impacted by violence? How is it important for their kids or their brother or their sister or their mother? How is it important for their family to engage in counseling, engaging in support services, so that they can address that ongoing trauma and still be productive parent, be a productive brother, be a productive person?
So thank you, Councilor Flynn, for bringing up that important issue. In my initial comments, I talked about exposure to violence. And that exposure may not be firsthand, it may be secondhand, it may be intergenerational, it may be from many different sources, and it may just be in your environment that you're hearing about violence. All of that has been studied, actually, to have a negative impact in how we process, how we engage, mental health issues, causing stress, causing anxiety, causing, symptoms of depression. That exposure in and of itself, even if it's not you, even if it's not in your family. So incredibly important for us to have resources so that young people and parents and caregivers can share, can talk, can, work with behavioral therapists on these issues. A lot of the work that we're doing in our Center for Behavioral Health and Wellness is looking at youth mental health issues, and we're putting a lot of resources in that. And specifically, a lot of those resources will be going to BPS, and a lot of the kids and the caregivers and the teachers and the staff members, they've all been exposed, either firsthand or secondhand, to violence, and I think in multiple forms of violence. I know we're here talking about gun violence, but certainly multiple forms of violence. So this is a critical issue, and I'm really glad that we're here to highlight it and amplify it. If I could just go back to your previous question, though, just about what city councilors can do, and obviously you all are doing a lot, which is why we're here. I think just naming and talking about the Community Healing Response Network as much as you can, because I think that we're doing something here that I haven't seen in all of their cities, this idea of focusing in on healing and thinking to ourselves, what is it that we need to do to bolster and support people, and again, not just the person, not just the victim and the victim's family, but the entire community when something happens. Knowing in this list of partners, who are the ones that you have connections with, who are the ones that work in your districts, and being able to talk about that. I think raising awareness is a huge part of the work that I think you already do, but just continuing to do that, especially as we go through this change from trauma to healing, as Reverend Scott mentioned. I think that's an incredibly important role.
Thank you, Dr. Ojikutu. Thank you, Mr. Chair. I have no further questions.
Thank you, Council. Council Murphy?
And thank you for filing this hearing and holding this important conversation, and thank you, everyone, for being here in your presentations. A few questions. I know you had just mentioned, Dr. Ojikutu, that this is focusing on gun violence, but we also, can have a drowning, a fire, yes. Other things happen that cause trauma. But, if we have a shooting in a park or, a fire in a neighborhood, it's going to affect the immediate family, but it will also affect other people in the house or on the street, in the community, right? If they're school age, it affects their school community. I know many of our community centers deal with that, where many of their members, if, something happens in the community, they're dealing with the after effects. So how far do we throw that net of support is my first question. And then also, it's not quantitative really, like how well we're doing, like what measures do we use? It's hard to see. I know as a mom and as a teacher, it was often the quiet ones, right, that you worried the most about, that maybe were worrying or stressed, had trauma, and they were silent. And the ones who may be acting out oftentimes would get the attention first, which was great, but you have to also, make sure you're not missing those who are also suffering. And it was said, but it could be weeks, months, days, but even years, especially if it's untreated. So like how long after, especially when we're talking about like the funding for it and making sure that we're kind of connecting it to that event and making sure if there is supports out there that we're still offering, even if a family may come later asking for help. And then just lastly, just a shout out, I was at a coffee with the cop in East Boston a few days ago, and I met one of the social workers who was working alongside the police, and they were both just raving and telling me how wonderful it's going, and that they were learning from each other, but that support was just great for the calls they were making. So just wanted to shout that out. But if you had any answers on the questions I'd asked.
So, Councilor Murphy, I wholeheartedly agree with you. I think everyone at the Boston Public Health Commission and the city and the mayor's office, is very concerned about the multiple forms of violence that many, if not all of us, experience, and the trauma. And it's one of the reasons why mental health issues is, a top priority of the things that we're doing and doing differently. I think, as you rightly stated, there's a limit in regards to funding and resources to being, active in as active as we would like to be in every area. But we should think more creatively about more that we can do. One of the things that we are doing, and I'll let Reverend Scott speak to it a little bit, is really thinking about domestic violence and sexual violence, and we are establishing an office for domestic and sexual violence prevention at the Boston Public Health Commission. So I think that, to me, is a wonderful step in the right direction to think more broadly about how we manage, address, evaluate, collect data on, and understand these multiple forms of violence, and think about what we can do about it and do differently.
And that's a different approach, right? A different response.
Exactly.
I know Councilor
Exactly.
Flynn had advocated, and I supported, to have a standalone
Yes.
domestic violence committee because the response is different.
That's right.
Yeah, the victims, need different supports and come forward differently.
Absolutely. Mark, do you want to, Reverend Scott, do you want to say a few words about that?
Yes. So I mentioned that there are a number of programs in the Division of Violence Prevention. One of them is the Family Justice Center, which it's a little, we are the overseeing body on that. That's the way it was set up. But it really is such a collaboration that we're really a part of it. And so the Family Justice Center has a leadership council, met this week. It has a number of organizations, including those BPD detectives who are investigating these types of crimes. So they're all there together in the Family Justice Center. The challenge is that we really needed an office that elevated the concern around domestic and sexual violence prevention, that made it more visible, that really had us tackle the issue of understanding the data, the narrative, the story about what's happening around domestic violence in our city. So it is domestic violence intersects very much with community violence. That there's a lot of deep, we tend to, our language, co-occurring cycles of violence. And so we took resources that we had that were really all being immersed into the Family Justice Center. We stay on the council, we're a part of it, we're deeply engaged, but we're also now able to create this new office to do all of those things around elevating this and understanding it and speaking for it across the entirety of the city. So what we got to get done is we have to hire somebody to run the office. And so we were very fortunate to get a really tremendous response from potential candidates, and we're getting close, I think, to being able to make a decision on that. And really, I'd say policy, engaging the city council on the work you've already done and talked about is, in the first 100 days of what we want to see happen.
Could you let us know when you hire someone? It would be great to have them in to talk about
Yes.
how we can support their work.
Absolutely.
Thank you. Thank you, Chair.
Thank you, Council Murphy. Council Coletta?
Thank you, Chair. And just a quick question. Was this your maiden speech?
This was, yeah.
Congratulations.
Thank you.
Congratulations on your first hearing, on your maiden speech, and congratulations on you being you, I guess. I don't know.
Yeah, sometimes you need to hear that.
and your chairmanship. And thank you all so much for your work on this. I have such a deep admiration and respect for all of you because this work is so heavy, and you are taking care of the hearts, minds, and souls of people who are going through the most traumatic incidents of their lives. And so just want to, and this goes for everybody in this room and that works on this. So I hope you all are taking care of your own in your own way and taking care of your mental health throughout all of this. I'm learning more in this space, and your presentation was very informative, so thank you. East Boston is very grateful to have its team, and I just want to thank the team there if they're listening in. Charlestown has always been fiercely independent and self-sufficient, and that just speaks to their spirit as a people and as a community. And so it is a community in recovery. It's a community that has seen violence over the last couple of decades. Recently, just last year and the year before, Dr. Yablo, I know that you've been working on this, but the Bunker Hill housing development has seen an increase in some gun-related activity, but East Boston as well too, in the Eagle Hill neighborhood. So my only question is to just ask, like, what does the landscape look in my district right now, which is East Boston, Charlestown, and the North End? It was good to know what the reactive and proactive measures are, but what are we doing in my community or my district to try to prevent some of this? I know that there's some proactive efforts taking place in your camp, Dr. Yablo, so I was just hoping if you could expand on that. Thank you.
Yeah, sure. As Dr. Ojikutu and Reverend Scott have alluded to earlier, Boston is the safest major city in the country, objectively. Similar to other major cities, we have pockets of individual neighborhoods where a disproportionate amount of violence does occur. The Bunker Hill housing development in Charlestown being one of those areas. Eagle Hill and specific intersections within Eagle Hill, or whether it's the Shore Plaza housing development, those are like micro communities that have experienced that violence. What we're doing, I think, on the prevention side is, as we go into the summer, especially, I have a grant funding opportunity, a summer activation mini grant, so we're being very strategic about allocating funds to these micro locations that have experienced violence. So that's kind of like prevention, leaning into the intervention. And then in terms of the intervention resources that we have available, making sure that the populations that reside, that are the most at-promise populations within these micro locations, are being prioritized for services, not just kind of services that are available to Joe Citizen, but services that are culturally competent, culturally appropriate, relevant, within the realm of what they need to actually heal. And that's anchored by whether it's the YOU Boston team. Councilor Murphy alluded to the Youth Connect program earlier that does amazing work across the city. Roy's team within the Health Commission, the SSYI team, and the MHI initiative. These are all different examples of the people that are going to be working on the ground. So I think it's a two-pronged approach of working with individuals that are residing in these communities, and then taking a community-level approach to understand that there are community-level interventions that you can set in place that will help to reduce the violence. And we're being very strategic. We actually had a meeting last week. We had a meeting in Eastie, and then last week, actually both Eastie and Charlestown, we were there last week, just planning, right? And that's a central part of it as well. So. And
I do appreciate, do appreciate your holistic preventative approach in some of these, as you name them, micro locations that often get overlooked, but there are kids, young adults who are at risk. And I live in Eagle Hill, and so I see it. And these are good kids, good young adults. They just need to be put on the right path. And I appreciate the fact that you're working with local nonprofits and trusted organizations who have already laid the groundwork and have been in the community and developing these relationships. So no further questions, just gratitude and thanks for being here. And thank you to the chair for holding this hearing.
Thank you, Councilor Coletta. And again, for the panel to understand as we wrap up here, I brought this forth due to the incident at Meeting House Hill on New Year's, right? And talking to the community afterwards, there was a murder on High Street, the first one of 2024. And when I met with them after the fact, they sort of said, we didn't feel the love, essentially, right? And so I appreciate now the better understanding of how you guys respond, what to do. I'm glad we're the safest major city in the United States, but that also should mean that we have more trauma too. We can spread the wealth of who is traumatized and how. And I would support a separate office for domestic and sexual violence because it is a very different type of trauma. And so whatever I can do in that field to help as well. But it would still be great. I just imagine, I'm just trying to think of, okay, if we've got now this sort of space or the bandwidth, being the safest city in America, to really focus on it, we should have a roadmap of what occurs, that when we come to these scenes and we can hand the person so that they can clearly see, because even hearing it from you guys, sometimes, right, you go, oh, okay, wait, I followed up to step 4, and then I got, right, and I'm sure that's what happens to the families, given they're going through the trauma themselves. So I would encourage just a roadmap or a handout that you guys, I'm sure there's some sort of handouts that you have, right? And I'd love to be able to see that at some point. But I think ultimately, thank you for what you do, and I appreciate the philosophical change. And I just hope that the fundamental structure is still the correct structure that we can respond most appropriately to not just the gun violence, but all violence, right? And so thank you for that. I invite you guys to stay, because I know we're going to hear from some of the third-party providers now. And in full disclosure, right, we know there's not always, in everything, there's always a little understanding of what needs to happen, or one side not feeling either compensated or supported enough. And so I'd love you all to invite to just stay to hear from the second panel as well. Because if we smooth those bumps out, I think we've got the best trauma team in the country, and let's, even though we have it already, let's continue to strive to be even better, right?
Yes.
Thank you very much, Pam.
Thank you.
Thank you.
Thank you.
I appreciate it. Well, the first panel is exiting. I'd like to now call the second panel up to the board for the folks that are on the second panel. I believe that is, I don't know if Clementine is here, but a representative from Lewis D. Brown. You guys please come on up. Marcus Lewis and Mona Lisa Smith from Bode Street Health Center and Mothers for Justice and Equality. If you are here, please take a seat. Thank you guys for being here. I appreciate it. Before we get to the questions from my colleagues, if you all could just introduce yourself and give you a brief overview of your role, and then we'll get into questions, and we'll take it from there. So who would like to start? Up to you guys.
I will go first.
Great.
And so my name is Mona Lisa Smith, and I am the president and CEO at Mothers for Justice and Equality. And for those that don't know, Mothers for Justice and Equality was started in 2010 by mothers who lost children to senseless street violence. And the reason for starting Mothers for Justice was that we really wanted to humanize our children and stress the importance of saving their lives and just bring dignity to the whole process of losing a child to senseless violence. And I'm honored to be sitting here with the Peace Institute today, who is, our sister organization. But as we are doing this work, and very proud to stay in the same space with the Boston Neighborhood Trauma Center, one of the things that I had thought about recently was how we have two experiences in one city, in the city of Boston. And when I say two experiences in the city of Boston, I think about how the weather is starting to get warm. And in one part of Boston, we have individuals who are enjoying the coming of the warm season. And really experiencing the beauty of the daffodils and the flowers and the cherry blossoms. And on another part of the city, we have a community that anxiety starts to weld up when the weather starts to get warm, because of the anticipation of an increase in violence. And so although we both have beautiful sceneries around us, but the experience and the aftermath of the violence has left us with two different experiences. So when we think about the necessity of having the neighborhood trauma team, the community healing space, it's so important because violence has left this trauma, this anxiety, this pain that doesn't heal as quickly as we would like it to heal. So I wanted to really come by today and just to share the work that Mothers for Justice is doing, and just that experience that we who have lost children to violence, and Aretha's here, and she can attest to that. And I thought it was important for her to come because she lost her son. And many of these murders are unsolved, right? They haven't gotten any conclusion. So that's the healing process. So it's not just the ongoing violence that we're working with, but it's also the aftermath of that violence. So, so that's what I wanted to share with you, and I hope that that has meaning in this moment. So, if I could have Aretha share a little, that would be great, if that's okay. If
Absolutely.
that's appropriate.
Good morning. My name is Aretha Moget, and I lost my son in 2008 on New Year's Eve on the MBTA bus. What's important to me about the healing process and the afterfact, when I lost my son, I didn't have any type of resources. I had a decent job, and I lost my job. And I lost the job because of the thinking and no healing after the fact. I wasn't able to function at work. And at that time, that job didn't have the type of healing resources that a mother like me needed to lose her only son. Although my son did not die to gun violence, it was a stabbing. And to me, that's even more personal, because you have to get up and close to somebody to actually do it. Whereas a gun, you could be from a far distance. So when it comes to a stabbing, I took that a little bit more personal than gun violence. We hear about the gun violence, but we have evolved. And it's not just gun violence, it's anything now. It could be any weapon now that could, take away your child, including pills. So there's many, many different platforms that occurred, and it's not just gun violence. What I love about working with the NTT team, I did start in the very beginning. It was nice to have a mother that lost out there to help. So I was able to show and see and talk to families that was going through. I was able to help with these healing mechanisms and the different things that needed to get on with life after. So joining Mothers for Justice and Equality after being a client, I decided to stay because my job that I was working at, they fired me for being non-social. If I wasn't getting the proper therapy, which at that time we still didn't have. We have a lot more trauma therapists now, but not enough. Not enough, because there's so many people waiting on a waiting list. And sometimes that is what causes more violence, because they're sitting there, they're still waiting, they're stewing, they don't know how to handle the trauma. This program is very important to me. That's why I'm still here. And I'm not just here just for a job. This is my life, because I am still healing. My son's case has not been solved either. So having this program helps. Having the resources, having the healing circles, and even having the training with me to be able to go out there as well, because I'm also part of the Boston Trauma Response Cohort, so I do be there on scene, able to talk to families and help them get through the situation. And we even take a step further and talk to the EMS when they graduate. I think that's very, very important, because they're not expecting how the family could be, or sometimes they may look at something that's being disrespectful when it really isn't. It's just that the family does not know how to deal with the trauma. So speaking with them and telling them this ahead of time, I think it helps their jobs. And I've also had many EMS people thank me after that. And also, I met the person that took care of my son. She spoke to him all the way there to the hospital. So that was very important for me too. I was able to thank her in person. Thank you.
And I am so glad Aretha brought up that part about the employment piece, because that's what we're dealing with now. A lot of the individuals who are having trouble getting jobs is because of a lot of the aftermath that's left behind, the mental health, the undiagnosed mental health, and the homelessness as well. So, our work, and I'm so grateful for the Public Health Commission and their partnership with us, because our work has really shifted to addressing this whole thing with healing through economic empowerment and helping individuals to get a job and keep that job, and doing that real pre-work that needs to be done. So there's definitely like a shift in how we're approaching the work, and having the partnerships like the Public Health Commission and this healing trauma team is so important in helping residents move forward. And I know you guys might have seen that article that the Globe had put out. And they talked about the life expectancy for Boston residents within a 2.5-mile radius changes by 23 years. That an individual living in the Back Bay section of Boston lives in their 90s. And the person living in the Roxbury section lives to 69. So when we think about like our work and what we're doing, how we respond to trauma, it's mortality, right? So not only are we losing people, to this senseless gun violence, but we're losing them to the stresses that are left behind in the aftermath. So I wanted to share that because as I was listening to Aretha, and we think about violence, we always think about the reaction to it, but we don't really think about like this whole thing with when we're dealing with unemployment, when we're dealing with housing, when we're dealing with a lot of different issues. It's stemming from that violence that happened to that individual, and the work that the Louis D. Brown Peace, Mothers for Justice, and so many others that I can name, that our work is shifting. And it's really shifting so that we are starting to make sure that we have the right employer partners, that we're addressing individuals who are reentering into the community. So having your support and the support of the Public Health Commission is just, it's essential. And I do believe that collectively, I think we can accomplish a lot. So thank you.
Thank you. And before we move on, I just want, Anita, was that?
Aretha.
Aretha. Aretha, so sorry to hear the loss of your son. As a parent myself, I don't know if I could do what you were doing right now, right? And so all my power to you and your continuing healing journey. And thank you for everything that you do. And thank you for sharing your story.
Thank you.
I know we have, Marcus is on Zoom, but you'll go next, right? What, your call? Marcus, if you're on Zoom, you were up. Thank you, sir.
Good morning. Thank you for having me. My name is, a lot of people know me as Brother Marcus Lewis. I am of Caribbean descent from Trinidad and Tobago. I have been a resident of Boston for over 30 years. I started working with the Bowdoin Street Health Center in 2015 as a violence intervention prevention, or some people know it as VIP. I was a coordinator for a program of the Boston Public Health Commission. The Bowdoin Street Health Center is a department of the Beth Israel Medical Deaconess Center, and it has been an active partner with the Dorchester community for over 50 years, referring care to infants, children, teens, and adults, and seniors. Recognizing how social and economic factors in the community can also influence the individuals and the health status, Bowdoin Street Health Center actively engaged the community organizations and the public entities to improve access to health, affordable foods, promote wellness through exercise, stress reduction, and community building. During my 7 years in the VIP role, I provided services to support residents, high-risk youth, and identify by the health center, referrals from partner organizations, and also for my own outreach efforts. Now, as a Community Healing Response Network community health worker, I support families impacted by community violence with resources to be connected by organizations such as the Louis D. Brown Peace Institute. We are Better Together, Mothers for Justice and Equality. I also refer families internally to the Center for Violence Prevention and Recovery. It's a program of the Beth Israel Deaconess Center. In addition to administrating community first aid to those who have been affected by traumatic incidents, as a health center, we can focus on the healing journey with the survivors who are impacted and the residents by offering activities such as fitness group, cooking classes, programs. We even have a community garden on Norton Street and Stonehurst. We have walking groups, we have healing circles. These resources are not just for our patients, but it's free to all the community members. The Bowdoin Street Health Center has a team of community health workers who support residents who are unhoused, have food insecurity, need health insurance, with all these other social determinants of health needs. While we have so many resources, there is so much more family needs, especially in a time of violence, such as being relocated, mental health support with changing schools, even organizing their funeral arrangements for their loved ones. The Community Healing Response team is there to help them navigate. However, survivors are often in a deep state of grief in these loss of their loved ones. It can be challenging to engage them without the proper support of a trauma-informed clinician to refer them where they're able to get the right distress at that time. We are thankful to our partner organizations, which help us able to reach these families in their time of needs and navigate through these traumatic experience. There is endless mental health resources that we need to make sure our survivors definitely need in the immediate time. So to expand that help and support is extremely needed. We need to find and build the capacity to hire more staff to support the influx of referrals we get. We are thankful for the City of Boston and the Public Health Commission, such vast services for looking into more ways to support the work and the families that we help. Your opportunity to speak today for the Bowdoin Street Health Center and the Community Healing Response Network. With more funding and services, these are wonderful programs and have great resources that can reach every single person in the healing trauma caused by the incidents of violence in Boston. And I thank you guys for allowing me to speak today and share.
Thank you, Marcus. Rachel, thank you for waiting patiently.
Thank you. Thank you, Chairman Fitzgerald and Councillor Flynn and members of this Committee on Public Health. Thanks for the opportunity to testify this morning. My name is Rachel Rodriguez. I am the co-executive director at the Louis D. Brown Peace Institute. Peace Institute is a Boston-based organization dedicated to supporting families and communities impacted by murder, trauma, grief, and loss, and fostering peace within the city of Boston. A little bit of history. Beginning in 1996, the City of Boston, the Boston Police Department, city hospitals, and other local government agencies began referring survivors of homicide victims to the Peace Institute for support in the aftermath of a homicide. While the Peace Institute quickly became the holder of families in their loss, the Peace Institute proceeded to also organize and mobilize a network of providers across practices to better coordinate services amongst stakeholders involved in a family's case. And just to refer back to something that Reverend Scott was talking about, oftentimes and still, whenever a homicide happens, there'll be so many stakeholders that get activated in some cases, and then in some cases, nobody will be. And so that's part of the reason why the Peace Institute felt it was really important early on to organize a communication network across the city of anybody who might be involved in touching the lives of a family after a homicide happens, so that we can coordinate services, avoid duplication, and also build relationships with each other. Trauma, violence is all very difficult, and it's very intense, and things move really quickly. And in order for us as providers to do this work, we have to have relationships with each other, that we can really call each other, talk things through, build that trust, and also just know each other. So that was the purpose of creating that network years ago. And we would train providers, we would just continually get together. It's clear that within our tenure, the Peace Institute has risen to the occasion to take our role to promote this. We're proud to stand with our partners at the Boston Public Health Commission and the Community Health Response Network, formerly NTT, and advocate that the City of Boston appropriately fund this initiative so that we can continue to work collaboratively and effectively to make sure we're responding to every homicide equitably across the city and in every neighborhood in the City of Boston. Just a little, I'm gonna come back to our network, but just to again talk through when a family is referred to the Peace Institute, they're met with an array of services, advocacy, and care within usually the first 24 to 72 hours after the homicide. Families are paired with a survivor outreach service coordinator who supports them through burial, memorial services, and crisis stabilization. We do this with our partners from the Boston Public Health Commission and also our, the neighborhood partners like MGE and everybody that you've heard from today. They will actually come if they have the relationship with the family and sit with the family and our staff. So we're doing this together in many cases in real time. The family continues to receive ongoing case management through the unfolding obstacles that often occur in the aftermath of a homicide. For example, the court process, mental health care, advocacy for children, emergency housing relocation, and meeting tangible needs such as food, transportation, utility, housing insecurity, and also what often comes up is assistance needed for laying their loved one to rest for the funeral and burial services. Families continue to move through our services. We have healing groups, workshops, Survivors Leadership Academy. We also have reentry services now, when applicable, to support families because there's not really a binary. People are impacted kind of on all ends of this, and even within one family. And also working with a network of survivors. There's so many survivor-led organizations that you've heard from today. There's so many incredible people who have experienced violence and trauma in our city firsthand, and they're the ones on the front lines, and they're the ones who are doing the work. And I think it is really unique that we have a city that looks to people who are most impacted as the experts in this and who we're putting on the front lines. Although 64% of families served at the Peace Institute reside in the City of Boston, the city currently contributes only 8% of what it costs to provide these services to Boston families whose loved ones have died due to homicide, suicide, overdose. It's for this reason that we've been really vocal during the FY25 budget. We've seen a lot of you all on a regular basis. We are advocating that the city's investment in our services are increased to a 3-year funding commitment of $1 million annually. We've proposed this to increase also the funding to the community health response that reflects this reality. I just want to go back to a little bit of history again too. Dr. Ojikutu said that Boston is unique in how we have this partnership where it's funding partners within the neighborhoods. It really is, and I think that it's very strategic that the city has an infrastructure in place to do this. I've been at the Peace Institute for almost 20 years, and pre-2017, it was us as a nonprofit organization that was kind of the holder of this communication whenever homicide would happen, to kind of activate a network. And I think that it's been a gain and a win that we have centralized communication now within, I'm still going to call it NTT. I can't get the new name down, but I really love the new name. That we have this centralized communication. That's really important for this work of responding to homicide. And I'm just going to stick on homicide. I know that is bigger, responding to traumas. But this being part of the infrastructure so that it doesn't really matter who's the mayor at the time, who's the commissioner of public health at the time, that this is something that's part of the city's infrastructure to have this way of communicating with community partners. And the importance of having the neighborhood teams and the neighborhood organizations that are funded through this partnership is because these community groups that are in the neighborhood, they were there before there was a centralized place for this in the city, and they're gonna be there continually ongoing. These are the experts who are in the community. These are the people who are most impacted by this, who have the connections. So I'm really, really advocating, and the Peace Institute is really advocating to make sure that this can be across the entire city equitably, not just in certain neighborhoods, but in every neighborhood. And that will continue to put further resource. The human beings who are actually going and doing this work on a day-to-day are incredible people. They're incredible experts. They're so knowledgeable. This work is difficult. It burns people out very easily and very fast. And we have to also, I think, as we continue to grow this network and to sustain it, invest in the further professional development, the healing, also the continued unification across the entire city. I can't stress that enough, how incredible the people are that are doing this work and that are in these positions right now. And we need to continue to provide support so that we can all continue and also pass on that knowledge and leadership so that folks can retire, so that folks can move on to other things, so that they can move through the ranks as they gain even more expertise through this. That's how this is going to be able to continue to sustain our city to be one of the safer places. I like how Dr. Yablo says it. That's all relative, but so that we can take that even further to Mona Lisa's point as well. Thank you so much. I'm happy to answer any questions and just want to say how important this partnership is for the Peace Institute and for the City of Boston.
Great. Thank you, Rachel, and thank you, panel. We'll turn it over to questions now. I'll quickly ask. I was happy to hear you mention infrastructure so much just then, because the way with the ask of your, a 3-year commitment of $1 million a year, right? I think the concern on the council side, as we have the fiduciary responsibility for the taxpayer money and how that's spent. And so we want to make sure, if that is an investment to be made, that the infrastructure that is set up currently or that is planned for is one that everybody's on board with. And so I would ask all of you, in your opinion, how this network is now set up, how it currently operates, or at least its anticipated form, is everyone's on board with? Because you did also mention having duplicative efforts, right? And where some folks, and especially on these providers, where things can be duplicative. And so that's where, on our end, we just have to say, okay, if we're going to give $1 million a year over 3 years, but some of the things are overlapped, are we doing our best fiduciary responsibility? And those are the questions we're obligated to ask ourselves, right? And so I'd love to make sure that you feel the infrastructure, well, there's the philosophical change that Dr. Ojukutu talked about, that the infrastructure as it's set up is the correct infrastructure, and is there anything that we think we can do to make it better?
I think that it is the correct infrastructure, and I think the point I was trying to make is that because we have this network now, it helps to avoid duplication of services. The fact, it's more about the coordination that it provides, so that we're making sure that, you know, this is what I'm doing for this family. What are you doing? We're making sure we're not doing the same thing, but we're complementing each other. And that's what the infrastructure that this network has set up now within the Boston Public Health Commission is doing. And I just wanted to clarify, the $1 million is for the Peace Institute to just be doing our work, but I would imagine it costs a lot more for the commission to do this and fully fund and support all of us as partners.
Yeah, right, which is why I talk about the overall infrastructure
Yes.
as well. But I understand the ask, yes.
I think the overall infrastructure is good. It is working. I think it's important for you and other counselors, whoever it may be at the time, to continue to do this practice of like checking in on things. That's how we're able to have our own checks and balances and grow.
No, I always say I'm not doing my job if I'm not making sure you're doing yours, right? That's our role. Mona Lisa, do you also agree as the infrastructure?
You know, I can't speak to the Peace Institute
Sure.
ask, but in respect to the, and I don't have the name in my head yet either, but I'm going to say NTT. But in respect to the model that that the City of Boston has around addressing trauma, you know, I think the Boston is in a very unique and special place,
Sure.
right? If we begin to look at some of our major cities who have much more violence than Boston, and we've had the opportunity to do that through the convening of our national conference in Boston at Boston University. The neighborhood trauma, this model that has been developed is a great model. It partners community-based organizations and health centers, right? So your community-based organizations are engaging the community members, really getting them to begin to trust again and feel comfortable with the whole healing process. And you have your health centers who are dealing with the clinical, the mental health piece of this. And so it formed this great alliance between, you know, community-based partnerships and health centers, right? So you can't go wrong with that. And then when you begin to think about not just being reactive to the shooting, but being proactive, right? So being proactive and really having this coalition of organizations embedded in each community that can respond quickly when something happens. And like Rachel said, it eliminates the overlap. So when I think about, you know, the Peace Institute, I think about Mothers for Justice and Equality, and you'll say, well, you know, don't you guys do the same thing? No. And I tell you no because when you think about the person who is impacted by that violence, right? They immediately need a place where they can go to help them to navigate the services, right? How do I bury my loved one? And I remember that when my nephew was murdered, that how does this happen, right? And I went to the Peace Institute, right? My niece did. And when you think about Mothers for Justice and Equality, we have to, as a city, help people move forward, right? How do you move forward after this loss? And moving forward means sustainability. It's about rebuilding that life and getting a job. Our job, many job placement centers do not know how to deal with trauma victims, right? There's another way of doing that work. And that's why we call ourselves a trauma-informed practice. And so when you have those agencies who are able to be together in such a network and be able to begin to look within ourselves as to how are we serving families, right? I remember having a family and this person needed something around housing that we couldn't offer. So within the network, those services are there. So I think, you know, Boston should give itself a round of applause for really having this unique model that does not happen around our country. What we could have done better was promote it and let the world know what we were doing. So I don't think there's overlaps. I think we need to really invest in building more, mobilization of services. And what I hear often is that Boston is resource rich, but people don't know how to get it, right? And that's our jobs. We help them to find those resources. So, so I hope that, that answers your question, but I think we have something very special that we should rally around, and we should look to how we can really, invest in it and build capacity in it. And that way, they're not over here, and we're over here, and More Than Words is here. We are coming together. And so that's my response to you, Councilor.
No, I appreciate that, Mona Lisa. And I believe it's our colleague Julie Mejia who always likes to say, Council Mejia always says, we're resource rich but coordination poor.
Yeah.
And that's what we want to make sure when we talk about the infrastructure and how it looks. If the coordination is there, then we can continue to fund it, to grow it, and to amplify it to a better level. So,
And
thank
I'm
you.
following her lead. I would like $1 million too.
Yeah, no, hey, you're in the right seat. This is when you ask, right? You never
Yes.
know. You never know until you
Write
ask.
that
So
down.
I appreciate that. I will turn it over to my colleague, Councilor Flynn, to ask questions of the panel. Mr. Flynn, you have the panel, Council. You have the floor.
Thank you, Mr. Chair, and thank you for coordinating an important discussion. And want to also thank the panelists for being here, for talking about your experiences. And first, I want to say to Aretha, we're very sorry for your loss and your pain. But I think through your loss and your pain, you're trying to help other families that are in a situation that you've been in, trying to provide them with some support and guidance. And through that terrible loss, you're really trying to bring people together. So I want to acknowledge what you're doing. One question I had, and I always thought about, especially as it relates to trauma in young people, teenagers. If your friend was a victim of crime, whether it was a stabbing or it was through gun violence, the victim's friends, they may be high school students, they may be 16, 17, 18 years old. If we don't get them the counseling support and services they need, I was always concerned growing up in the city, but I was always concerned that more victims of crime would take place because of the retaliation. But how do we reach young people, the victims of crime, their friends or their siblings, even their brothers or their sisters? How do we reach them before or immediately after the situation, after the violence takes place, to show them that another path is possible through counseling, through support, through constructive improvements? But violence, responding to violence with violence is certainly not the answer.
You are 150% correct, Counselor. And a few things that we do at Mothers Trust and Equality is that we have a youth development area. We are working at South Bay. Mm-hmm. They have what's called a peace unit for 25, I think it's up to 25, and these are first offenders that are coming into the prison, and they work with them so that they don't reoffend, right? So we go in there and we work with them. We also have a second chance program, and through thank you for the Shannon Grant dollars, in those we're able to provide stipends. So when they leave prison, they come to us, and we start to work with them on some of the mental health stuff, right? So we're doing assessments. We're not clinicians, but we partner with other clinical partners, and if they need that, we get them that, right? So we're bridging the gap between that, and we get them a job, right? So first we do like 3 months of just kind of pre-training. Then we're looking for employer partners that would take them, and we pay the internship, but would you take them and let them have that experience? During that time, we're doing the coaching, the mentoring, continuing the counseling, and our goal is that they'll go from 15 to 18 to 20. The stipends are so important because they need money, right? We can't just program them and think that they're going to be okay with programming. We have to give them stipends so that they don't return back to the life that they knew, right? Then we're working with young parents, right? So there's these individuals who have become parents at a very early age. And in our youth program, we've just had 2 births of children. And so trauma begins in the womb. And so really beginning to work with young parents, helping them to understand how to be parents, but also addressing the Second Chance program. And now, with the support of Children's Hospital, they just did a grant around youth and health and mental health. And so we're starting to train youth to be advocates. So really thinking about a peer-to-peer model where you can train a young person to begin to talk about mental health and how important it is. We have to break the stigmatism around mental health and what it means. We have too many young people who have bipolar and other disorders that are undiagnosed. And that's what we're looking at, right? And if it's undiagnosed, they're either going to end up in prison or they're going to end up in the grave. And so we are definitely trying to get in front of that. And there's a lot of resources, and I heard the Public Health Commission talk about it as well. But you're absolutely right. I mean, if we're talking about ending violence, we have to talk about the young people who are burdened with this mental health that is undiagnosed, unaddressed, and it's one of the social deterrents of mental health that these are communities who we're seeing high rates of unemployment, chronic illness. It's because the mental health was never addressed. And it's real. I see it every day with mothers that it never got addressed. And so we have to talk about it. And it has to be on the forefront of conversations. And the inequality that has existed in families in our communities getting proper treatment. So I thank you for bringing it up. Because I know, the Peace Institute and Aretha will say the same thing, that is real, and that is in front of us right now. And COVID made it very visible, but it was always there. Mm-hmm. Mm-hmm.
The good thing, so what Mona Lisa talked about too, is that interventions have to happen on multiple levels. Primary, secondary, tertiary. It has to be in our schools with young children. It has to be available when something has happened, and also after the fact. And that's the good thing about this network too, is that there's partners that are doing work in all of those areas. At the Peace Institute, one of the things that we get asked a lot, and we get asked a lot about, what are you doing to prevent violence? And, we are working in a space where oftentimes we're not getting connected to people until the worst thing has already happened. And so our stance in kind of trying to transform the way society thinks about homicide and thinks about prevention too, is that an equitable response to a trauma or to a homicide is also prevention. Because that's where, if you are responding to everybody, no matter the circumstances, no matter the age of the victim, no matter whether it was a shooting, stabbing, or if the person had a criminal record, if you are responding as a city, as a community, equitably to this family and surrounding them by all of the supports that are out there and are possible, and saying that they're worthy of these things and that their loved one's life is valuable, that is going to help to provide a space for healing to happen even more readily and more quickly. What we talk about as a network too when we're responding in the immediate aftermath of a trauma or a homicide, we really try to normalize that feeling homicidal and retaliatory, also suicidal, using substances to cope with it, like alcohol and drugs. These are really normal responses to what has happened, and so we provide a lot of education collectively to the families that we're talking to. We're trained, all of us, to notice these signs and to have those difficult conversations. And sometimes what those difficult conversations look like is families in our office, it's 3 days after their loved one was murdered, and they're sitting there and they're talking about, like, I don't know what to do. My son's friends are about to do something. Mm-hmm. And I'm worried. I don't want them to retaliate in my son's name. We're like, all right, well, what can we do? They're coming to you. You have their ear. You have their heart. And so we're also like supporting families to have those really difficult conversations in the moment. And I think that those type of things that happen within the Peace Institute and also the work that all of us are doing across the city and having those difficult conversations, you're never gonna know sometimes if that worked, but we're out there and that's what we're doing. And we know just because of the relationships that we have that those type of things go a really long way. And you're planting seeds. And somebody might come back to you, and it has happened. Somebody will come back to the Peace Institute 10 years later and be like, you know what? Because of what so-and-so said, I didn't do this thing that I was gonna go do. I was literally sitting outside and I didn't do it because we planted seeds. So there's things that we're never gonna be able to measure, but that really is the work that's happening.
Thank you. Yes, go ahead, Irene.
I just have one other quick thing to say also. It also affects the community. So I wanted to say an example for the young man that was killed, 12-year-old, across the street in his home, but it was across the street from a park. I got that call also to be there on with the first responders, but I was in the middle of doing something else. So what MJE did is because when we did arrive on the scene, well, I arrived on the scene to see how it was doing. A lot of the things that I was hearing is, oh, now I don't have no place for my kid to go, can't go to the park now, this shooting, although the shooting was isolated and in. The rumors and the drama that's going on is we can't bring our babies to the park. Well, I was there the very next day with the youth, and what we did is we had STEM activities, we had games, we went to the Mildred Ave and invited the summer program to come out and let them know we were there. We didn't want them to feel like because of that shooting that happened, the park is closed and it's not safe. We showed them that the park is still safe and that children can still come out and play. So we did that STEM thing for 3 weeks after that shooting to make sure that the residents knew that the park was still available. And we would do different programs there at that park so they would continue seeing that we are still supporting and coming out there and letting them know that park is safe. So I just wanted to share that.
No, and thank you. And thank you for doing that and helping the community heal. Marcus, I don't know if you have anything to add. Otherwise we'll...
Yes, just want to speak to a little bit more towards the prevention. And when I used to do violence intervention, one of the biggest things was really connecting to the youth regularly in our community, making sure they had the opportunity to jog. They knew about the BCYF facilities, which were free to them, and they were utilizing it. Connecting with the sportsmen and ADSLs and collaborating to making sure activities was constantly within our parks. Our community gardens were being kept up and utilized because we also found those was the areas when they wasn't utilized. more gangs would take over those areas and utilize those spots, and really creating safe spaces, making sure job availability and youth leadership groups and mentorship programs, partnering with Big Brother, Big Sister, and thinking outside of the box of what makes a safe summer and changing the view to these young people, because they're really looking at what is going to stop this happening from me. I hang out with the same people. These people are family to me. What is going to make it not happen to me and make me not want to retaliate or just look for more safety? Connecting to our community police department, our CSO officers, and creating that community policing and having the community feel that they're able to turn to our officers, not only in a 911 situation, having those walking groups and activating our community, reaching out to our neighborhood associations and finding out what are the concerns that are coming in, that we could start pre-actively taking a look on what can we do for this area. If this area is being run down and it's not being kept up, what can we do? How do you utilize 311? But informing, engaging, educating from our young ones up to our seniors are facing what is going to stop this from happening to me, my family, after a traumatic incident. So that prevention work is really important, connected to those residents. And because each one of our microsites have a prevention connecting with the health centers, those collaborations are able to be done in live time.
Thank you, Marcus. We will now move forward with public testimony. Panel, you guys are welcome to just stay there if you want. There's only one person, and then we'll wrap up. But when your name is called, please come down to one of the two podiums, but I don't think they're here. They're actually on Zoom. Just please state your name, neighborhood, and/or organization affiliation, and please speak into the microphone and keep your comments to. It says 2 minutes, but Alexis, you are the only person here to testify. So please, take 3 minutes of your time, please, and tell us your testimony. Thank you very much, Alexis.
Hi, can you guys hear me?
Yep, we can hear you, Alexis. Go ahead.
Okay, good morning, everyone. My name is Alexis Smith, and I am the mom of Amin Lacey. It's been a while, but I wanted to reshare the reason why I have been doing the work that I do, and what it is that I think would be very helpful to us progressing to a next phase of what we need as a community and what we need individually. So I'm going to read a part of his journal that he wrote in September 2017 before he lost his life in December 2017. So he says, "Who I am. My name is Amin. I am 17 years old. I'm African American, Cape Verde. Also, I come from a Christian family. My background, I have played basketball for a team called the Boston Spartans for 4 years. Also played for a soccer team. He played for 4 baseball teams and ran track. My key life experience, traveling different places with my basketball team like Florida, New Jersey, etc. I have been to a lot of places in life. Goals I have in life is to try and make it to the NBA, but if I don't, I need to come up with a backup plan. I still don't have a backup because what if I don't make it? Every kid doesn't make it. But another goal in life I got is to graduate high school, also make it to college. Socioeconomic status. I would say I don't live in the hood. I moved out when I was 7 years old with my mother. But college, I want to go. It's so much fun. I want to leave out of state for college and play ball on campus. He wanted to play at Michigan State for their Spartans team. That was our top goal. After college, I hope I can make it to the NBA, but if not, college should help me find a good job. After I graduate, gender, well, I'm a young man about to be a man, but I did used to get jumped by other kids. By the time I got older, that all stopped. I couldn't fight back because I didn't know how to fight for myself and stand up to what they was doing. My mom helped me get back on my feet because I was going through it. I was tired. I felt like life is too short. I was trying to hurt myself and no longer be on this earth anymore. Kids were bothering me to the point I wanted to take in my own life. But the woman that made me was the one calming me down and helping me from hurting myself. I wasn't crazy. I was being bullied. After passing that stage, I became stronger than what I was. My mom fought for me and got me into a good middle school. It was called the Epiphany. Great school, went there for 4 years and then graduated. After that, I started my first day at a high school. That was another course to college. Good school, just wasn't fit for me. It was a great school, just didn't have what I needed. Also, I was lost, hard for me to catch up, so I needed a new start. And that was something that me and Amin was working on, finding a new place that would fit and work for him as Epiphany did. We both understood his personality, how his brain functioned, and what would be a very thriving environment for him that connected to what I just read to you. Amin was a very good young man and wanted so much more out of his life. When he was going to the Kroc Center, he started getting threatened and told me he no longer felt safe going there. So all the community places and places that I try to find that would be fitting so that he can continue to thrive and never become a part of the problem, and the problem never comes to my front door. That didn't happen because the people that were supposed to support us wasn't consistent and didn't take what we were saying seriously. I took him to court a couple days before he lost his life, trying to find safety for my son because he said that someone had recorded a video with a weapon, threatening my life and waiting for me to come home. I still live at this residence. 2 summers ago, someone came to my street and was shooting. I still live at this residence. I've tried to find multiple resources on multiple occasions to help me and Amin. We have been vulnerable and expressive about our trauma on multiple occasions and never really got the support that we needed. I live in fear, weary. A job that I was trying to pursue in the medical field, I didn't end up pursuing because the doctor had committed suicide because he was caught with child pornography. I never got help for that, and it never made me feel like I wanted to go back to that field. The work that I do with everyone is free-handedly because I feel like it's safer for me to kind of be an entrepreneur mover than to trust that the people that say that they want to do things to make a change is actually going to make a change with me. Because every environment has been a traumatic experience to the point where I've been depressed, I don't feel motivated at times, and when I do want to get out there and do something, I lose that drive because my trauma doesn't get addressed or the services that I ask for seems to be unreachable, like moving from my apartment, restarting my life, trying to pay my bills, get everything situated because I put all my money into keeping my son safe by having him play sports, go to sailboat camp. Me and Amin did not get much time together because I was trying to keep him safe away from what happened to him. And it happened to me at 12 and a half years old. I am a gun violence survivor. I still don't know who did this to me. I still don't know who did that to my son. And I try to keep him away from influences that would change his life as a child. And because of what occurred, a child wasn't addressed. He's not looked as a child, an innocent child, a good child, a child that had dreams and goals to be something more than a statistic and to continue what's been going on in our city. And that's gun violence. Unrealistic things for reasons that never really make a lot of sense. We should be able to thrive in this community, and I feel like we need to talk more in depth about what's going on, what's happening, and how do we reach resources when we come to and say, this has happened to me, this is happening to me, I need to get out of here, I need to get my son to safety. It shouldn't just be DYS, DSS, and do I feel like people, in a sense, see what my son was doing or if he were gonna tell on them? And that wasn't the case. It was like, we need safety away from here. The influence and to drag him into a life that he never wanted, and it caused him to lose his life. I feel really sad for a young child, a young adult, not even adult that didn't begin his life, but he did get to do a lot of amazing things to make me proud, to make his city proud. And I feel like a lot of times that I don't get support because of what happened. But no one looks at what he did, what he was, and what we did together to be productive people. And still, what I do today to help others, I can't even really get the help that I give out to my community. And that makes me feel hopeless at times. That makes me lose my drive sometimes. And it also makes me not even want to be a part of certain things anymore when I really want to, and I should be able to and deserve to, and not live in the cycle of sadness because I put all this work in to feel like it was all for nothing because they're not here. And all the work that I put in to be a good person, there's no reward, it seems. So I just wish that people would talk more in depth, be more and more intentional, be more honorable, and really show up for families and people that are coming to you and being vulnerable and sharing who they are and helping us to build something more because, like she said, there's so many other kids left behind that need support and help. I would love to do so much more with them. Like me and the kids were just talking at Means Party about next year. We should get a house and get away from the city and just go have fun and celebrate his birthday. Sometimes I don't have the resources to get help or to further the help that I need and going to different places. I gotta pay my bill. If I can't get resources to help me, I can't choose between my mental health and my bills, then I get, oh, you gotta get out, you have to leave, or you can't stay here anymore. So then how do I get my mental health support if I don't have the finances to do all? If I'm dealing with so much, I can't go back to work yet. I need to make sure that I'm okay first and have the tools I need to re-enter society, to re-enter these networks that have failed me and Amin on so many levels.
Alexis.
I'm not gonna beg, and yes.
Oh, sorry. No, I didn't mean to cut you off. I just wanted to say.
No, that's okay. If it's a 2-minute time, it's fine.
No, we are.
Go
at time,
ahead.
but I'm not concerned about that. We've spoken, and I've heard your story before about your son, but certainly not in the way you just told it. It certainly hits even more emotionally, and so, again, sorry for your loss. And I want to make sure that you yourself are getting the help you need. I know you've worked with the Peace Institute. And I hope that you continue to. The services that I think you're seeking are the ones we're talking about supporting today and making sure we amplify for people like yourself going through what you're doing. And so, continue to reach out to my office, reach out to the services provided. And again, you do a beautiful job of keeping your son's name alive. And so, thank you so much for your testimony, Alexis. All right, and we'll see.
Thank you so much. And the Peace Institute does great. They definitely help support me, but I need other resources and support. They can't do it all, cover it all. So there's those other parts that I need help from other places, but the Peace Institute has definitely helped me in a tremendous way with what they do in their organization. So thank you. I appreciate you guys' time today.
Alexis, and thank you for your time.
You're welcome.
With that, Councilor Flynn, I don't know if you have a closing statement.
I would just like to say thank you to the panelists for being here, for your testimony, for the important work you do in our community, helping so many families that desperately need it. And I hope there's an opportunity for the city and the city council to support you and the outreach programs that you're doing. Thank you. Thank you, Mr. Chair.
Thank you, Councilor. And many of you have maybe heard me say this before, but I sort of start, my overall approach to this job in general is keeping families in the city, right? And building that infrastructure that families can stay, because when you build around families, everybody benefits. You don't have to have kids just to live here and enjoy it, but if the infrastructure is there, and sometimes that's around housing and it's schools and it's safety, but other times it's the smaller things about just making sure that our residents know that they're cared about, right? And I think that's what you guys do on the ground, especially when hard moments hit in life, that you guys are there to show them that they're loved and that they're cared for. And that helps keep the continuity of families in this city, right? And that is what over time will be able to chip away at the violence. And I think that's what Boston does a great job at now, and we have to continue to do and to fund and to support. And I know the work is not easy for all of you, so I thank the panel of Mr. Isaac Abloh and Dr. Ojakutu, Reverend Scott, Rachel, Mona Lisa, Aretha, Marcus, thank you for coming today. Really appreciate everything you do. Please stay in touch with the office as we go forward, and please ask, whether we get it or not, ask away, right, all of you, and continue to push for ask. We all know that's the only way it happens.
Next week.
Yeah, you can call next week. But so thank you all for coming. Thank you for all that you do. I learned a lot today, and I feel much better about the way that we're approaching this, and we are here to support you in any other way going forward. So with that, this hearing on docket 0415 is adjourned. Thank you.
Thank you.